like this, or coughing a lot, or seems to be in distress, immediately please go and help that person, okay? This is how people indicate to you that they are choking, okay? Gayatri, adugamma start cheyachalu. Start? Shall we start? Actually, అప్పుడే కాదు నేను చెప్తా. ఓకే. Good evening. So we are all here to learn CPR, first aid for choking, first aid for seizures, and save. You had samosa also. Save? Yes. So, before starting the session, I want you all to remember some very important things. Okay? First, never ever forget to call 108. Okay, if you forget, then help won't arrive in time. You can't keep on giving CPR forever. Right? Okay. Second thing, I'll ask you a question, you will answer me. We are now in Saptaparni. Okay. So, there's a main road nearby. You were coming and you saw that somebody was lying on the road. Okay. So, what would you do? What would you have done? You answer, please. Call 108. What would you have done? Call 108. What would you have done? Anybody has a different answer? Somebody said move. Move the person off the road, she said. Okay, why did she say that? Okay. So if it's a victim of an accident, we are not supposed to move them too much, right? So what other thing you can do to ensure the person is safe and you are safe? Stop the traffic. Okay, otherwise what will happen? Next I have to come and give you all CPR. Ante kada? Correct or not? Okay. So, please sit, ma, please sit. Okay. So, scene safety is very important. And what else did you learn from here? If it's a victim of an accident or a victim who has fallen down from a height. Okay. We are not supposed to move them too much because there is a potential chance that the spine is fractured and the spinal cord could have got injured. Okay, so no bending the spine, no turning the person, no moving the person without stabilizing the neck and spine. Very, very important. You'll remember this? Okay, so somebody has fallen from a height, either into a lake or from building onto the floor, or is a victim of an accident. Please do not bend the spine. Do not do anything which will bend the spine. So if you don't do good also, it's okay, but do no? Yes. Okay, so scene safety, please do not forget. Okay. And yeah, now there's another question for you all. Okay. So First thing, in social media we are seeing viral videos. The person is talking but people are giving CPR. Okay, please give CPR only if the person is not breathing or is gasping. Like that. That's all. Okay, just because a person is unconscious, you are not going to give CPR. Harshini, kucha ma. Sit. Okay, so don't give CPR just because. Or when should you give CPR? Not breathing or is gasping. Okay, we are talking about lay rescuers. Lay means medical knowledge is not there. Not that they are not educated or anything. Okay, right? Okay, so when they are not breathing or they are gasping only, we are supposed to give CPR. Okay, clear? Clear? Okay, so that is one thing. Okay, now second thing is when it comes to children, okay, or adults who have fallen from a height or victims of an accident or victims of drug overdose or alcohol overdose or near drowning victims. Say these three things again. Near drowning victims, victims of an accident or drug overdose. So children and these adults, these three situations, you will give 5 cycles of CPR before calling for help, before calling 108. Okay, if the person is not breathing or if the person is gasping. Whereas for other adults, you will first call 108 and then start CPR. Okay, now comes the question. Here only. Okay, just for a second imagine that I am a child, okay, 49-year-old child today. Okay, right. So a child, not 49-year-old, 4-year-old. Huh? Okay, child. Suddenly I collapse and I stop breathing. Okay. Third from front. Yourself, ma. Yes. What would you do? Wonderful. So I thought she'll say, because it's a child, please give 5 cycles, then call 108. But what did she say? Because so many of us are there, you call 108, one can call 108, one can do the CPR. What I said is for a situation where you are the only rescuer. Okay, please sit. Okay, so another situation. We are sitting in, which is the closest hospital? Star Hospital. We are sitting in Star Hospital and suddenly somebody collapsed there. Yourself, what would you do? Pink dress, Nana. Yeah. What will you do? You're sitting in Star Hospitals. Suddenly somebody collapsed. Next, who wants to answer this question? Lift your hand. Answer. Activate code blue. But you are a lay rescuer, right? You don't know the word code blue. So what? So you shout. Basically you wanted to say that only. You call, you say somebody has collapsed, please come. Then obviously code blue will get activated. Okay. So depending on the situation, you have to use presence of mind. There you are a lay rescuer, whereas you are sitting in a hospital, a tertiary care hospital, where there will be one huge emergency team there. Okay, so you have to use presence of mind. Okay, even if they come, you should not say, no, I know CPR, I'll only do CPR. No, okay, clear? Understood? Clear? So presence of mind. Very, very important. So, other thing is, if you don't know the person, please avoid giving breaths. Okay, and if the field is full of blood and you have cuts on your hand, just make sure you don't come in contact with the blood because your safety is very important. Okay, or if you are not able to give effective breaths, then we'll stick only to chest compressions, just pressing on the heart, that's all. Clear? Clear? Okay, so who watches movies? Okay, rather who don't watch movies? Okay, so what happens? Common scene, near drowning scene. Who rescues whom? Villain rescues hero? Heroine rescues hero. I haven't seen a movie till now. Who rescues whom? Then he'll press on the stomach. Then one breath. Then, now who will give the correct answer? Romantic song starts. Okay. So, what they are showing in movies is not right. You are not, even if it's a near drowning victim, please do not press on the tummy. Because if that person had swallowed something, it will come back and may block the airway. Rules are the same. Okay, they don't change just because they show it in the movies and just because we want to have a romantic song or just because it's a near drowning victim. Okay, clear? Who watched Luck movie? Not even one person now. Sanjay Dutt, Imran or Irfan Khan? Imran Khan. Imran Khan, Shruti Hassan. I'm so sad. I watch more movies than you. What's happening to this generation? Huh? Okay. So there is this game. Okay. So Sanjay Dutt owns a company and they keep giving challenges. Okay. So they will try to kill you basically. And if you escape, you get 1 crore rupees. So there will be 5 desperate people who are in need of money. So they take up the challenge. Okay. And then he kills, I think 3 of them. Obviously hero and heroine have to survive, right? Huh? Okay. So he shoots Imran Khan. And he will think that Imran Khan died. He shoots correct, like right, like left side of the chest. Okay. But Imran Khan survives. Why? Right. So chest compressions, whether heart is on the left or right, where should we give? Middle only. We can't ask that person, no, where is your heart? Stranger. So it is only in the middle. The guidelines are same. Okay. So that's one thing. So these are just to lighten up the mood I am telling you, but still take home points. You understand, right? Never forget to call 108. Ensure scene safety, your safety. And rules are the same. Don't go by what they are showing, at least in Bollywood or Tollywood or Collywood or any wood movies. Hollywood movies are okay. Okay, they show them right. Okay, right? And whether heart is on the left or right, chest compressions are in the center. One more thing I want to, and if it is a victim of an accident or fall from a height, please do not do anything which will meddle with the spine. In the end of the session, I'll show you what's called log roll method, how to move that person. Suppose like nobody is there, you have to move that person, you have to shift that person. I'll show you, we'll all show you how to do it. Okay? But randomly you can't move that person. Okay? Right? And one more important thing, if it's a pregnant woman, if it is a pregnant woman, you should never press here as first aid for choking. Okay? You are allowed to press here. Okay? Right? Clear? Not on the abdomen. If it's for obvious reasons. Okay? Right? So now I'll narrate a scene. You have to tell me what went wrong there. Shivaji movie. Rajnikant fan. Okay, right, fine. Okay, what happens? One child gets electrocuted and he's thrown onto the floor from the building. What do those people do? Immediately pick him up and put him on the trolley. What mistake did they do? They have not stabilized the spine. Okay. So other examples will come later. Okay. So we'll start the session now. These things are very clear, no? Okay. So we'll start with seizures first. Okay. A very common emergency, especially 6 months to 6 years, it's very common. When children have fever, even otherwise also, it's a common emergency. So what do they do mainly in India when there is a seizure? In spite of me telling so many times, recently one mother, they were searching, they were actually carrying the baby, that CCTV recording was there. Okay. Or CCTV or the parent recorded. The grandmother was carrying and searching for a door handle. In spite of me educating them so many times. Because when a situation is tense, you tend to forget. You just thought block. So you have to keep your calm. Dr. Ishwar? Yes, help. So yours is the orange team. Okay. Yeah. So, understood. So, first thing is do not panic. Okay. So you understand that, okay, seizure can happen when my child has fever. So, or it can happen with anybody. It can happen with anybody. So, first and foremost is ensuring safety. So, one difference is, in children generally we don't see this type of seizure. We see this type, like they just become stiff, roll up their eyes and they become unconscious. Okay, so don't panic. Okay, so whenever there is seizure, ensure they are safe by putting maybe a cushion or a pillow nearby or slightly a thin one under the head so that the person doesn't hurt himself. Okay, and once the seizure passes off, remove whatever is there in the mouth. Okay, and turn the baby to recovery position. Recovery position. See, side lying and head and down compared to the leg end. This is called recovery position for infants. Slightly older babies also you can hold like this. Even some older children you can hold like this and go to the hospital. Okay, please do not try to put key or throw water. Sometimes splashing water can precipitate another seizure. And if you put a key, you may not be doing any good, but you may do harm. One example I know is they went and poked their eye with that key. And that person lost his eyesight. Okay, please do not put key in the hand. Okay, only thing is ensure safety by putting cushions so that the person doesn't hurt themselves, and whatever is in the mouth remove. Don't blindly poke. Check whether the person is breathing or not. Ensure the person is breathing. Then hold the person like this and go to emergency. This is for infants and slightly younger babies. Okay, for slightly older person, I want to do a demo of recovery position. Any volunteers from the students? Any volunteers from the students? This is all recorded. You can go back and see the YouTube videos. There's no place? Can some of you sit here if you don't mind? No. I'm asking the students. Some of you, can you sit here if you don't mind? Their seats, their places. Okay, where am I? Yeah, recovery position. Can somebody come here? We'll ask one of the boys. It's live streaming, kada? Come. Right. You have to become unconscious now. Head that side. Yes, he's unconscious. Okay? He's unconscious or not? Huh? Okay. You're unconscious. You can't laugh. Okay. Then it's like he's sleeping and I'm putting him in recovery position. That's not fair, kada? Huh? Okay, right. Okay, so aeroplane position of this hand. Do it. Yes. And this hand to the cheek. Okay. Okay. Clear? Okay. Then pull the knee and like this, so that the knee is supported on the floor. Okay. Right? I will show again. I'll show on the wall. Okay. Right? Clear? This is called recovery position. Okay. Right? We'll do on the other side so that the video is easy. Okay. Clear? So this hand helps to keep the neck straight. And the side lying position ensures that whatever is in the mouth falls out rather than go back and choke the person. And this knee here, make sure he doesn't roll back. Okay. You have to become conscious fast. Okay. Come, get up. So, give him a big hand. No, don't go. So, some people at the back, they couldn't make it. They couldn't see properly. So, we'll show a standing demo. Think there is a wall here. Think there is this is the floor. Okay. 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 Clear? This is the floor. Okay. Right? Yes. Okay, that knee should be resting on the floor. Clear? Clear? Okay. Thanks, Ma. Thank you so much. Give him a big hand. Okay, that is called recovery position. When do you put the person in recovery position? When he is not breathing? Huh? When he is not breathing, you will put in recovery position. When he is breathing but not conscious. Okay, when he is breathing but not conscious. Say again. If a person is not breathing or is gasping, what are we supposed to do? Yes. No confusion? When you are giving CPR, suppose the person starts breathing comfortably, what will you do? Again put in? Okay. Right? Clear? Conscious, not breathing. Conscious, not breathing. Conscious, not breathing. Is that a possibility? Then, see, I want you all to pay attention. Conscious, how can he be not breathing? Okay? Pay attention. Ma ikkada kuchali. Come. Okay. So, unconscious, not breathing. Now you hesitated. Okay. Unconscious and not breathing, CPR. Unconscious but breathing. Very good. Okay. Conscious, not breathing? Not possible. Okay. Conscious, unconscious and breathing? Unconscious, not breathing? Unconscious, gasping? Okay. Clear? Clear? Those of you who have come late, everything is recorded. It is being live streamed. It will be available on the YouTube channel. Okay? Okay. Clear, no? Okay. Now, seizures is done. Okay? So, we'll do choking first aid. I will need Dinesh for 5 minutes. Miro, you can take over for 5 minutes. Not needed, anyone? No, you have to attend. Somebody is, okay. Okay, come. So choking. If it is an adult or a child, choking, if it is an adult or a child, the principles are the same. But only thing is, if it's a child, obviously you have to kneel down behind the child. Okay, to make it work. Okay, right? So, what do you do? What is choking? What is universal choking position? So, if somebody is doing this and is coughing or seems to be in distress, please go and help that person. Okay, this is called universal choking position. Okay, what is choking? What happens in your households when you are choking? Okay, so it doesn't help, right? Okay, what else happens? Back is okay because that's in the first aid. They give you water. Sorry, I'm already choking. You want to choke me more? No. Only when that comes out, okay, and your throat is already irritated. To soothe it, you can drink water. Okay, clear? Everybody attentive? Sure? So conscious not breathing, what you will do? Last. Conscious and not breathing. Okay, sit. So it's not possible. Okay, right. Okay, so I'll catch if anybody is dozing off, I will know. Okay, I'm seasoned artist in this. Okay, right? Okay, so very important, when you are choking, if the person is, when a person is choking, if the person is coughing, do not disturb, whether it's a baby or a child or an adult. Let them cough. Encourage them to cough. That's the best defense body has given us. Okay, let them cough. Okay, but suppose they are not able to produce any sound. No noise is coming. Okay, baby is not crying, turning blue or limp. Okay, so or a sound like this, stridor, like that is coming. Immediately you should help that person. So position behind yourself. One of the girls come, Nana. Volunteers, yeah, come. So position yourself behind the person. Position yourself behind the person. Okay. Position yourself behind the person in such a way that even if the person loses consciousness and falls, you are able to gently get the person onto the floor. Otherwise, the person may injure themselves. Okay. So just between the shoulder blades. Give 5 back slaps with the heel of your hand. I won't hit her hard, but in real life situation you have to. Okay. 1, 2, 3, 4, 5. Okay. Right? 5 back slaps. And then 5 abdominal thrusts. They are called as Heimlich maneuver. Where do you give Heimlich maneuver? Stay here. So this is the belly button. This is the tip of the breastbone. Okay, in between. Approximately 2 inches above the belly button. Approximately. So all of you make a fist like this towards yourself with the thumb pointing towards that area which I showed you just now. Don't press. You would have had food, right? Okay, right. Okay. The thumb side pointing towards the point. Okay, whichever is your dominant hand. Okay, right? And cover it. Okay, and give 5 abdominal thrusts. Okay. I have hurt myself, so Dinesh will show it. Yeah. 1 second. Yeah, 5 abdominal thrusts. 1 second. 1, 2, 3, Back and up, Dinesh. 4, 5. No. So then again 5 back slaps. Okay. Okay. 5 abdominal thrusts. 3, 4, 5. Okay, 5 back slaps. Yeah, 5 back slaps. Properly. Yeah. 5 abdominal thrusts. Manchiga check. Okka second. 1 second. Pike. Okay. Anybody wants to try? After 3 cycles of back slaps and abdominal thrusts, try. 1 second. Okay. Sorry. After 3 cycles of back slaps and abdominal thrusts, okay. If you are not successful, please call 108 or start to the hospital doing the same. Any of you want to come and try? Come. Okay. So after 3 cycles, if you are unsuccessful, you have to call 108 or start to the hospital and continue doing this till when? Till it comes out. That is the first thing. Yeah. Okay, 5 back slaps. 5 abdominal thrusts. Yeah. Lean it forward. Okay. Yes. Okay. Okay. So, back and up. Back and up. Okay. So, if after 3 cycles, thank you ma. After 3 cycles, if you are unsuccessful, better call 108 or start to the hospital. As much as possible, continue doing this till it comes out or the person loses consciousness. Okay. The person loses consciousness. Okay. So, what will you do if the person loses consciousness? Very good. Check the breathing. See? Okay. So, if the person loses consciousness, first get them onto the floor. Okay. Slowly get them onto the floor. And then check for breathing. So, where I'll just.
Yes, you can.
Okay. So, here and back and up. Back and up. Back and up. Okay. So, 5 back slaps. Okay. And 5 abdominal thrusts. Back and up. Back and up. Okay. More pressure, but obviously I won't do it on her that way. Okay. Till the food comes out. If the person loses consciousness, slowly get them onto the floor and then check for breathing. If they are not breathing, clear? Clear? Okay. Thank you. Clear? So recovery position everybody understood? Now what if it is an infant? Okay, what if it is an infant? Okay. Hold the infant steady. Don't press on the neck. Okay. Right? The rules are the same. Only if the infant is not producing any sound or is doing this. That's all. Okay. Don't press on the neck. I am supporting the jaw. I am supporting the baby on my forearm. Okay. And again I am supporting my forearm on my leg. 5 back slaps between the shoulder blades. 1, 2, 3, 4, 5. Okay. Now, if anything is visible and easily removable, we'll remove. Never ever blindly poke. If you blindly poke, what will happen? It might get deeper inside. Okay. Now 5 chest thrusts below the nipple line in the center. Earlier they used to say we should use 2 fingers. Latest guidelines is you have to use the heel of your hand. Okay. 1, 2, 3, 4, 5. Okay. Clear? You could not see? Last row. You could see or you could not? Stand. Whoever couldn't see, stand and see, because this is something you have to know for sure. Okay? Okay, clear? Supporting the baby on my forearm, clear? Okay? And then supporting myself on my thigh. Okay? 1, 2, 3, 4, 5. Okay? I will check. Nothing is there. If something is there, I'll remove. Okay? No blind poking. So if I'm not successful, I'll give chest thrust with the heel of my hand below the nipple line in the center. 1, 2, 3, 4, 5. Okay? Clear? So 5 back slaps, 5 chest thrusts. 5 back slaps, 5 chest thrusts. So after 3 cycles, if you are unsuccessful, what will you do? And continue doing this? Continue doing this till the foreign body falls out, or till the person loses? If the baby loses consciousness, what you will do? Check for breathing. If the baby is breathing, you go to the hospital this way. If the baby is not breathing, after 3 cycles, if you are unsuccessful, what you will do? Call 108. But I don't know how reliable that is. So maybe it's better you start to the hospital, continuing to do the same. Continuing to do the same. Okay. Till you reach the hospital, or till 108 comes, or till the foreign body falls out, or till the baby loses. If the baby loses consciousness, what you will do? Okay. If the baby is not breathing? If the baby is breathing? Okay. What is the difference then? While doing CPR in this situation, keep checking intermittently if something has come into the mouth. Okay. And remove it. That never blindly poke. Clear? Okay. So now you have learnt most of the things. So we'll do the CPR thing and then do the practice session. Okay. Before that, I want to ask you one thing. Some neighbor called you and said a fish bone is stuck in the throat. What will you do? Perfect. Who said that? Go to the... Who said it? Wonderful. Okay. These all are not things we will try to do anything. And hospital also, where you are for sure that a good emergency department is there with good ENT backup. Don't waste time. The only first aid you are allowed to do is you can make the person suck on ice. Why? The coolness will constrict the blood vessels and make sure there is not too much swelling in that area. Okay, right? Because removing a fish bone stuck in the throat requires expertise. Not anybody can do it, please. Very dangerous. Major blood vessels are there, you all know that. Okay, clear? Moral of the story, don't give fish bones food to at least children, to at least children. Okay, right? And one more thing, please, when you are eating food, mindful eating. Teach your children also the same. No distraction and all, please. And avoid foods like gummies, nuts, whole grapes, strawberries, etc. Uncut strawberries, etc. for children below 4 to 6 years of age. At least for children below 4 years. Even otherwise, don't give gummies. Please. Okay. Right? Clear? Clear, ma? Yeah, ask me.
Are you taking questions now or should I ask later?
Ask me.
Could you just share a bit about what to do in case of epileptic attack or fit? So once what has happened is I was just going somewhere and I saw something happening when then people also call it as a ghostly intervention.
No. Seizure thing we have already done.
Yeah.
Maybe you joined late. So during the
It's the same only. So
seizure means epilepsy, fits only.
yeah. So just the doubt is someone also put a bucket of water.
That's what. Don't splash water, don't put keys, don't run around looking for a metal object. Just ensure the person is safe. If anything is in the mouth, remove, but do not blindly poke and check for breathing. If the person is breathing, put in recovery position. If the person is not breathing, give CPR. Don't put spoon in the mouth also. If you want to really maintain, you want to make sure they don't bite the tongue, you can roll a towel, a small towel and put there, but not spoon.
Can we use the same amount of pressure even for the toddlers and babies?
No, you have to control accordingly. Okay? Not the same amount of pressure. Okay? So, for children, obviously you will use lesser amount of pressure. Okay? Right? But it's always in the center, not on the sides. Okay? Clear?
While showing the choking hazard, the intervention for the infant, you were thrusting when you were hitting on the front, as opposed to
The two-finger technique.
pressing the adult.
Yeah, here it's hitting only. Latest, recent change in guidelines. Earlier it was pressing with two fingers to a depth of around 1/3 to half. Means if like the depth. Earlier it was like that. Okay. So 1/3 to half it has to go in. But now it has changed to this. And these choking devices, lot of ads are coming nowadays, but they are not the standard of care, not endorsed by, as of now, any first aid society or any academy of physicians or pediatricians. Okay. You are seeing, no, those ads. Even Jim Carrey also did one video. I know more movie, I have more movie knowledge. Huh? Okay. Right, Jim Carrey you know at least? Okay. Okay, fine. Now coming to, now this person is unconscious and not breathing or is gasping. Okay, whatever the situation may be. Then only we give CPR. Okay, so, he is choking Charlie. So, situation, this room was closed. Okay, nobody was there in the room except Sivarajani. You entered. Who will I ask? Nobody who attended my sessions earlier should answer this question, okay? Right? Okay. You entered the room, you saw me lying down motionless there. Okay, no movement. What will you do? Check for breathing. You ma, first. Yeah. Common sense please. You. Yes, I am not moving. Call out. Okay. So don't directly jump to breathing. I must be sleeping here, exhausted. Huh? Please. Please. Okay. Don't suddenly jump and give CPR to me, please. Okay. So check whether the person is conscious or not. Check whether the person is. So if it is an adult, hello, hello. Okay, only the shoulder please, nowhere else. Okay. Shake the shoulder and shout loudly. And as I said, if it is a victim of an accident, no moving the person. Okay? Right. Or can I do, hello Kannamma, wake up. Huh? Which is correct? Shout loud. Okay? It should penetrate across the layers of the brain and reach his consciousness. Okay? Clear? Clear? Okay. So, if it is a child, you tap. Okay? And if it's a baby, you are allowed only to tap on the sole of the foot. Okay? Hello baby. Okay? Clear? So if you find a person motionless, please don't suddenly go for breathing and CPR and all that. First check whether the person is conscious or not. Can anybody make place for them? If you don't mind, you can sit. There's a chair there. Okay. Clear? Everybody. So check for consciousness. So what will the person do if he is conscious? Wake up and or mumble, open eyes, move, cry, anything. Okay. If you directly give CPR, what the person will do? Okay. Huh? Yes or no? Okay. So always check for consciousness. Then if this person is conscious, obviously it's fine. Okay. If the person is unconscious, what will you do? Now you check for breathing. Before checking for breathing, remove whatever is there in the mouth. Okay. So check. Okay. Something is there. I'll remove. Check. Something is there, I'll remove. Okay, but never ever blindly. Why should we not blindly poke into the mouth? You might push the food or anything further down. Okay, so how do you check for breathing? Okay, so just tilt the forehead little bit and look, listen and feel. Look, listen and okay, look for the chest rise, listen to the breath and feel the breath. Okay, clear? Baby, we don't tilt the forehead too much, only slight tilt, okay? Look, listen and feel. Okay, if the baby is breathing, what do we do? Okay, clear? If the baby is not breathing, if the person is breathing, recovery position. If the child is breathing, recovery position. If the child is not breathing, CPR. Okay, if the person is not breathing, CPR. Child also, same CPR. Infant also, CPR. Okay, clear? Clear? Can I revise once? If a person is lying down motionless, you will first check for consciousness. Okay, by shouting loud and shaking the person's shoulder. If it's an adult, child you tap, baby you tap on the sole of the foot. Okay, if the person is not conscious, then you check for breathing. Okay, look, listen and feel. All of you say? Look, listen and feel. Okay, if the person is not breathing or is gasping, we'll give CPR. If the person is breathing, we'll put the person in recovery position. And when do you call 108 now? If you are the lone rescuer, first give 5 cycles of CPR in case of children and in case of adults who are victims of near drowning, accidents and drug overdose. Okay, and then call 108. For all the others, all the other adults, you call 108 and start CPR, and please do not forget to tell them to bring AED. AED. Okay, I am not going into AED now in this session, but you can all watch that video. St. John's Ambulance has a very good video on AED. Minimum age is 1 year. You would have seen in certain life-saving rescue situations in the movies. You would have seen, right? They use prompts from something like a what do you say? Like a tape recorder it looks. You would have seen they would attach and they'll give current shock. You have seen, right? Yeah, that's called AED. AED. Okay. So automated external defibrillator. Okay. So I'm not going into that right now. Okay. So that part is not being discussed here. Okay. Right. So call 108 without fail before proceeding with CPR. Okay, sure? Don't forget. Okay. Again, should I repeat the situation? Okay. So we are all sitting here. Nobody who has heard me before should answer this question, okay? Right. So you have, yourself. So you have here, like, think of this as a child. Okay. Suddenly this child has collapsed. You have checked for consciousness. You have checked for breathing. The child is not breathing. You'll call 108 first, or you'll start CPR first? Think and tell. Why I said children you have to first do CPR 5 cycles and then call 108. You're not alone. Somebody else has to call 108, someone can start the CPR. So you have to use your presence of mind. Okay, clear? Okay. So CPR has two components. One is chest thrust and the other is breaths. Okay. Today I will be showing both chest thrusts and breaths. Okay. But when you practice, we'll allow you to practice only chest thrusts. That's called calls. Compression only, life saving. Okay. So this is what you are going to mainly teach in schools also. All of you. Okay. Right? Okay. So when do you stop CPR? Who was the first to answer? When the person is? Who said that? Okay. When the person starts breathing. Okay. So if the person is unconscious also, if the person is breathing, this is the rule I want to emphasize on. You are not giving CPR. You are only putting them in recovery position. Okay. When the person is unconscious but is breathing well, we are only putting them in. Okay. We are not giving. We give CPR only when the person is not breathing or is gasping. This has to go properly. Okay, so when do you stop CPR? When the person starts breathing well. So what will you do? He has not regained consciousness but he starts breathing well. You put him in. Clear? So first I will show on the adult and I will tell you what to do if it's a child also. Okay? Okay. So what did I say? Heart is on the right or left? Chest compressions are? Center. Okay. No. Who said left? We don't know. Some people can have it on the right also. I think you joined the session late. Okay, who is that? Yourself, okay. You watched the movie Luck? Okay. Okay, you should go back today and see the movie ending. Take my number from Harshini and message me why I said this. Okay, chest compressions are only in the center. Okay, right? I'm doing this, I'll do it on the table also, but on the table because of the height, my elbows get bent. So I'll show it on the table also, but first I'll show the right technique on the floor. Okay, so for CPR, all of you feel your tip of the breastbone. Yeah, just above it with the heel of your hand. That's where we press. Okay. Tip of the breastbone, just above it with the heel of your hand. For children we use one hand. For adults we use two hands. Okay. Clear? Okay. So this is an adult mannequin and your elbow has to be straight and the pressure should come from the body, not just your wrist or anything. Okay. So one hand. Okay. Clear? Right? And the speed is 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and all of you say? 1
and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9.
So 100 to 120 per minute, not more than 2 per second. And the depth has to be 1/3 to half. Depth has to be, actually they say in inches, I don't want to say that because it's a bit confusing, adult and baby and all. So 1/3 to half. Okay, not more than half, not less than 1/3. Okay, right? So we do 30 chest compressions and 2 breaths. 30 chest compressions and 2 breaths till the person starts breathing or till help arrives or till you are tired. If you are tired, you have to hand over to someone else. Okay, and if the person is a stranger or if you are not able to give effective breaths, please don't give breaths, give only chest compressions. Clear? And if it's a child, we use one hand. Okay. That movie Flood, a Korean movie, where they did nice CPR. Flood only, the flood I think. Yeah. Correct, no? Yeah. So watch that movie. Not movie, it's a serial I think. I mean whatever they call it nowadays, series. Okay. Netflix, no? Okay. Straight? Okay. All of you count. Okay. So, only thing is, you should not do only like this. You should allow the chest to recoil. You should allow the chest to recoil. You should allow the heart to fill, right? Okay. Then give 2 breaths. When we are practicing, we are doing only chest compressions. If anybody wants to practice breaths, they have to take bag and mask and do, not mouth to mouth. Okay. Clear? For breaths, and if it's a child, we use only one hand. For breaths, tilt the forehead, pinch the nose. I'll again show it on the table. Tilt the forehead, pinch the nose, lift the chin, take a nice deep breath and breathe in for 1 second, looking at the chest. Because if the breath you are giving is effective, the chest should raise. Okay? Okay? Yes or no? Okay? Clear? Okay. So, the rule is the same for both children and adults. For infant, it is different. I'll show it on the table. There you will see that my elbow may get a little bent, but it's not supposed to be. Okay? And when you are giving CPR, try as much as possible to see that the person is on a flat surface. Okay, right? So hands have to be straight. As I said, here it's difficult for me because of the height of the table, but I'll try my best. Okay? 1 and 2, 1 and 2 and 3 and 4 and 5 and 6 and... No, here it's not. But you got the funda, right? Hands have to be straight and the pressure has to come from the body. Okay? So when we make you practice, we'll make sure all this is taken care of. Okay? And breaths, tilt the forehead, pinch the nose, lift the chin, take a nice deep breath, and look at the chest whether it's expanding or not. Okay? Clear? Suppose this is a victim of an accident. What I did is right or wrong? Why? Yeah, I should not bend the neck. Without that, whatever I can do, I should do. As I said, if you don't do good also, it's okay, but do no harm. Okay? There is a risk of paralysis. Okay? Clear or not? Okay. Now if it's a baby. Now if it's a baby. So the rules are the same, except that how do you give chest compressions? Okay, think of me as the floor or bed. Bed is soft, we want a hard surface. Okay, right. Okay, so tip of the breastbone, this one, these are the nipple line. This is the nipple line. Just below the nipple line in the center. Just below the nipple line in the center. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And 2 breaths. Okay? Other way you can do is like this. 1 and 2 and 3 and 4 and... Okay? Like this. Okay? You can do it this way also. Clear? For an infant. Infant means up to 1 year. And for breaths, we don't pinch the nose. And we don't tilt the forehead too much. Only slight tilt. No pinching the nose. We lift the chin. Take a nice deep breath. And seal the baby's nose and mouth with our mouth. And breathe in for 1 second. Okay? Okay? Looking at the chest. So if you are not able to give proper breaths, what will you do? You will first check if anything is there in the mouth. Again you check, you remove, you'll adjust the position little bit. But still it's not working, then don't waste time on the... You'll do only... Or if it's a stranger, only? And if there is lot of blood in the field? Huh? If there's lot of blood in the field, make sure it doesn't touch any cuts or abrasions on your hands or anywhere. If it's a stranger. Clear or not? Okay? 30 compressions, 2 breaths. 30 compressions, 2 breaths. Till the person starts breathing or the person or help arrives or you are tired. In which case you'll hand over to somebody else. Clear or not? Okay, 5 minutes we'll have doubt session and then we'll proceed for practice.
Question. I mean, you have a very long career. So what are the chances of a person living if you're giving a CPR? Say out of
What is the chance of?
the chances of a person
Uday,
living?
almost 6 out of 10 deaths can be prevented by giving right first aid at right time, but exact statistics I am not sure. Within 4 seconds. No. So what is the chance? So depends on the situation. Suppose it is an anesthetic overdose. The chance may be a little less, though the whole team is there. But we can't say actually, yeah, that's true. Yeah. So we can't really say. But what statistics say is 6 out of 10 deaths can be prevented by giving the right first aid at the right time. And CPR, if you try to initiate within the first 4 seconds, the higher the chance of survival. Okay. Any more doubts?
Hello, check. Hello, check. Hello, hello,
Hello?
check.
Hello? Any questions?
During choking, ma'am, if the arm if the arm length of your arm is smaller than the circumference of the
Yeah, just asking if it's an obese person, you are not able to enter completely. What is it? High legs. So you can press on the chest, abdomen. Okay. Clear? Yeah. Any more questions? Yes. Give the mic to. See, no CPR is worse than giving some CPR. And giving best CPR is always better than some CPR. So you can improve it by constantly revising it, watching the video again and again. You can, like how you prepare for an exam. If this question comes, I'll write this answer kind of. So you can always imagine a situation and keep on repeating it. And now we are going to give you a practice session. So all these will help for you to reach near perfection. And most importantly, as you said, obviously if it's your family member, you'll panic. Recently a mother messaged me. She's been following up with me for so long. She attended first aid sessions. But when it really happened for her child, she didn't panic. She kept her cool. She knew it would pass off, a febrile seizure. But only thing is still that recovery position thing she didn't remember. Okay. So main is, like, that's why you have to constantly revise so that when the situation actually arises, you'll be able to handle it better. Yeah, any more questions? Mike.
If a person qualifies for CPR, let's say he is gasping or he is not breathing, and also he has fallen from a certain height and he has injuries, so whether I should do CPR or considering his injuries that I am giving so much of pressure on his body.
So here you have to say, well, otherwise he'll die, no? Only thing is don't bend the spine.
Okay.
He's not breathing, nobody is around. You're the only person there, you know CPR.
Okay.
At least give chest compressions.
Okay.
See, otherwise anyway he's going to
Yeah,
die, right?
yeah.
So you have to give your best. Yeah. Anyone else? Pass the mic, please. I need 5 volunteers to come here to do the demo of log roll method.
మ్యామ్ తెలుగు
Come. Students, come. చెప్పమ్మా.
ఒక వ్యక్తి అన్కాన్షియస్ అయి పడిపోయాడు. నేను లేట్గా రీచ్ అయ్యాను. సో యాక్చువల్గా ఆ పర్సన్కి చోకింగ్ అయింది. సో నేను వెళ్ళిన తర్వాత నాకేం తెలిసిందంటే హార్ట్ పల్స్ లేదు, అన్కాన్షియస్ అయ్యాడు. సో నేను సిపిఆర్ చేస్తే ఆ వ్యక్తికి ఏమవుతుంది? యాక్చువల్గా వాడు చోక్ అయ్యింది.
చోక్ అయ్యి పడిపోయాడు.
కానీ choke అయిందని నాకు తెలీదు.
బై ద టైమ్ యూ రీచ్డ్ a person unconscious ante, so you have to check whether he is breathing. He is not breathing, you have to give CPR irrespective of the cause. choke ayi unconscious ayyada, breathing lekunda ayipoyada, vere reason valla ayyada, ఏ reason valla aina breathing లేకపోతే నువ్వు CPR ఇవ్వాలి. కాకపోతే చోకింగ్ వల్ల అయింది కాబట్టి మధ్యలో నోట్లో ఏమన్నా వస్తే తీసేయాలి, గుడ్డిగా పడవకూడదు. ఓకే, నాట్ క్లియర్?
అంటే నాకు తెలియదు మ్యామ్ వాడు చోకింగ్ వల్ల అయిందని.
నీకు తెలియ అవసరం లేదు. నువ్వు వెళ్ళేసరికి అబ్బాయి స్పృహలో లేడు, అబ్బాయి బ్రీత్ చేయట్లేదు, అంతేనా? నువ్వు వెళ్ళేసరికి స్పృహ లేదు, బ్రీతింగ్ లేదు, అంతేనా? సిపిఆర్ ఇవ్వాలి. అది చోకింగ్ వల్ల, నీటిలో మునిగితే బయటికి తీయటం వల్ల, సీజర్ వల్ల మనకు తెలీదు, హార్ట్ అటాక్ వచ్చిందా మనకు తెలీదు, స్ట్రోక్ వచ్చిందా మనకు తెలీదు, బట్ అక్కడ బ్రీత్ చేయట్లా, మనం సిపిఆర్ ఇస్తాం. ఓకే, ఆ సిపిఆర్ టైంలో లక్కీగా ఆ ప్రెషర్కి చోకింగ్ అన్న అయింది, బయటకు వచ్చింది అనుకో, మనకు కనపడితే తెస్తాం.
అంటే ఏం కాంప్లికేషన్ ఉండదా మ్యామ్ చోకింగ్ వల్ల మనం సిపిఆర్ చేస్తే?
లేదు,
ఓకే, థ్యాంక్ యూ.
మహా అయితే ఒక రిబ్ ఇరుగుద్ది, బట్ ఇక్కడ లైఫా రిబ్బా? You have to decide. Okay, clear? And there are many laws who will protect you if you give CPR, and you with good intention, if you give CPR but you suppose damage a rib or break a rib, there are many laws to protect you, but just to be on the safe side, if there are relatives around, take their permission. Okay, take their permission. Maybe you can record it also for your own safety. Anything else? Okay, we'll do the log roll method. Somebody has to hold the mic for me when we are doing that, and I need 5 volunteers plus somebody to hold the mic. Boys, run. Come. 5 of you. Anna. Okay, come. 5. You also. How many are there? Yeah. Come. You want to be unconscious again? Huh? Or somebody else? You'll hold the mic. No, okay, you hold the mic. Come. Who is the unconscious person? Come. What is there? You want me to lie down? I don't mind. Come. Okay. Okay, fine. Okay. So this is a victim of an accident. Is it? This is victim of an accident. Come, all of you. Okay. You come here. This is victim of an accident. Sit, all of you. Kneel down. Okay. Now I have to shift him. There's nobody. Ambulance has not come. Nothing. Okay, I have to shift, or I have to turn him to recovery position. If I have to shift, I have to find some flat and hard plate or wooden board or something. Okay, right now, how to first turn him? Okay, first stabilize the neck. Okay, right? Yeah. You put your hands like this. You put your hands, you also, and You will say 1, 2, 3. All of you simultaneously will turn him to this side. Okay, 1, 2, 3 simultaneously. Okay, and somebody will put the plate there. Again 1, 2, 3. Okay, right? Neck bend avakoodu. Okay, again. Do it again. Wait. You don't lift your head, ma. 1, 2, 3. Don't lift the head. Okay, we should not lift the head.
Hello.
Okay. And 1,
Panchu.
2,
Hello.
3.
Hello.
Okay, clear? Clear?
Excuse me.
Okay. Okay? Yeah. Can you show it on the mannequin? Okay? See, like this. Uday, show it here.
So the whole idea is not to move the neck part, right? So, how do I show?
Yeah, correct.
So you support the neck and place your hand over the shoulder. So it will be fixed. Got it? This position and all. Like this.
Can you all do it on the people in front of you?
He should not be able to bend his neck.
No, really, practice.
The neck should not bend. That's the whole idea.
Okay?
See, even when I'm moving here.
Yes. Yes. Okay? Show on him. Okay? Clear?
That's to you, but
Okay.
I'm just showing when we
Yeah.
are moving.
Yes. Okay? Clear? Okay. Now, ready? Ready? 1, 2, 3. And back. 1, 2, 3. Slowly. Clear? It has come correct? Okay. So this is called log roll method. Clear? Only this way you are allowed to move the person. Otherwise, don't move the person. Like in Shivaji movie. We should do what they did or we shouldn't do what they did? Okay. How do they give CPR and breaths? You remember? The person will be looking at the face, like that he'll be doing. Okay. So when you are giving breaths, look at the chest for chest rise. Clear? Log roll method clear? Okay. If there is a chance of spinal fracture, please do not move the person unless you have enough people to do it right. And that too, if somebody more experienced in handling this is there, let them do it. Okay? Clear? Clear? Okay. Thanks. He's become conscious. Yeah. Okay. Thank you. Any more doubts?
If there is any hard surface to do a log roll and the hospital is nearby, how can people with their own hands, is there any possibility like that?
You should call them or somebody go take a bike and bring them. Bring the ambulance. Call 108 because it is connected to the nearest hospital. You can give your location. Immediately they'll send the team. Am I right? It's better not bend.
We should not even...
No. You can give CPR if they stop breathing, but don't forget to call 108.
to transfer the person.
No, better not.
Rather than the accident, the movement itself causes more damage.
If he's paralyzed completely, then it's...
Yeah, I got it.
You got it, no? Okay. Any more doubts? Log roll method clear? One more team can come and do. Come. 4 of you. Girls this time. No, only if you are comfortable. Only if you are comfortable. Come. After this, we'll move the chairs and we'll start the practice session. We are practicing chest compressions. Yeah, lie down. We are practicing chest compressions and Heimlich maneuver. Okay? And choking first aid in case of infants. Okay? Right, lie down. Yeah, you are at the head. One more person will need. One more. One more girl. స్పెట్స్ నాకు ఇచ్చేస్తా ఇంకొంచెం పుట్ యువర్ హ్యాండ్స్ ఓకే అగైన్ 1 2 Nana, your hands, you are only holding one leg. Yeah. 1 2 3. Okay? Clear? Clear? Okay, thank you. Thank you. Okay, so now fatafat, all of you just disperse the chairs and make place in the center. Dr. Ishwar, take your mannequins, no?
Just slabs ఇచ్చారు. Just thrust.
కాదు స్లాబ్స్ ఎప్పుడు
Without raising the hand or slabs.
స్లాబ్స్
Just thrust. Just thrust.
చెక్ చేసావు చాలా చోట్ల నువ్వు చెక్ చేయి హలో థ్యాంక్ యూ దిస్ వన్ ప్రదీప్ జస్ట్ స్లాబ్స్ ఒక్కసారి చూడు ఏ చేతి చూడు కనపడట్లా నాకు కళ్ళు చూడలేదు టర్న్ చేయండి లేఅవుట్లా వాళ్ళు స్లాబ్స్ అని చెప్పారు
Just thrust.
నేను ఇంతకుముందు వీడియో స్లాబ్స్ చూపించారు
Slabs, just thrust.
అదే రెండు స్లాబ్స్ చూపించారు ఇదే వీడియో ఏచేదా లేటెస్ట్ ఓకే ఆల్ ఆఫ్ యూ జస్ట్ హోల్డ్ సో 1 second there is a small correction okay so what I have seen a couple of months back ఒక్కసారి what I have seen a couple of months back okay so the choking they showed as back slaps okay and chest slaps that's what I told you but Dr. Uday showed me the latest video where he's saying yes it's the same with the heel of the hand but you don't lift okay clear okay so this is going live no okay so 5 back slaps okay and 5 chest thrusts with the heel of the hand below the nipple line in the center 1 2 3 4 5 okay these guidelines have changed very recently and each and every video I had seen it showed as back slaps but the latest one is showing chest slaps but the latest one is showing it's not slapping it is thrusts okay clear no confusion no 5 back slaps and 5 chest using? Okay, no confusion, right? Okay, okay. We'll proceed, and this belongs to? Huh? Chepta. Whose is this? Dr. Pradeep, ఇది ఎవరిది? Okay, all of you, mats పెట్టేసుకుందామా? No need for mats, just orange go to that corner. Dr. Ishwar. Yellow go to that corner, sorry. Yellow go to that corner, Uday. Uday, yellow. ఓకే అది కెమెరా అటువైపు తిప్పండి. ఉండను, అక్కడికి వచ్చేస్తా. సారీ. This side in the center, green. This side in the center, light blue. No, light blue is done. Dark blue, center. You are? Sky blue here. Pink here. You can see the dresses doctors are wearing. Pink here. Dr. Vignata, Dr. Nikita, Dr. Pradeep, dark blue. In the center. Okay. Dr. Uday, yellow, last. Dr. Uday, orange, Dr. Ishwar, that corner, orange. And here in the middle, green, Dr. Gayatri. Okay, everybody is at your stations? Yeah. Any group, there are too many people, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You two come here. You two come here. Any group more than 12 send to me, no, here. Yeah, one of you come here. Any group, if it is too big, send two people come here. Just two come here. Yeah. Last groups also, if too many are there, come here. Then, Dr. Ishwar, do you want to send a couple of students here? Send them. Okay. Open chain. Come. No, you are in which group? You come with me.
I'll just give her the sprays.
Oh. Baby also. Get the baby. దగ్గర ఇప్పుడు లేదు మా మీరు ముందు చెప్పండి. ఓకే come. How we are having so many? Okay. Do you need spare mannequins? Consultants, do you need spare mannequins? No? ఉంచేసేయండి. Yeah, start practicing. Come. show me chest compressions. Whichever is your dominant hand. Yeah. Straight. Speed కొంచెం దగ్గరికి జరుగుమా. 1 and 2 and. Pressure is nice, speed can increase. 1 and 2 and 3 and 4 and. Yes. Okay. Show me hind legs. Okay, in the end you will show. Okay, show me chest compressions here. Okay, okay. So you prefer this method. Okay, show me choking first aid. Stand and show. If she's doing wrong, please tell me. Support yours. Okay, turn. Yeah. Below the nipple line. Okay? Okay. Show me hind legs. Hind legs. Choking. You can show there if you want. But that's a little tough, but you can show. That leave it. Just show hind legs. Back and up. Back and up. Little leaning. Back and up. Tough, huh? Okay. Come. You start chest compressions. Next person there. బ్యాక్ అండ్ అప్ చేయమా. దీంతో ఇలా పైకి వెనక్కి లోపలికి. అది ఇప్పుడు వచ్చింది. ఫస్ట్ టైం చేసినట్టు కొంచెం కదిలింది. యూ కుడ్ హియర్ దట్ సౌండ్, రైట్? సో యూ హ్యావ్ టు డూ దట్, రైట్? ఓకే. ఓకే. దేర్ చెస్ట్ కంప్రెషన్స్. విల్ వెయిట్. లెట్ దెమ్ బోత్ ఫినిష్. ఇంకా డీప్. ఇంకా డీప్. ఎస్. విఘ్నత సైడ్కి చేస్తున్నాడు. ఓకే. దిస్ వన్ యూ డిడ్, యూ ఎక్స్చేంజ్. ఓకే. షో మీ చోకింగ్ ఫస్ట్ ఎయిడ్. హ్యాండ్ స్ట్రైట్. చేయాల కదిలిపోకూడదు, ఒక్క పొజిషన్లో ఉండాలి. ఇక్కడి నుంచి రావాలి బలం అంతా, బాడీ నుంచి రావాలి. ఓకే సార్. అది ఇప్పుడు అర్థమైందామా? ఓకే. యా, షూర్. ఫైవ్ అండ్ దెన్ ఉంటే తీసేయాలి, లేదంటే నిప్పుల కింద. నో, అదే చివర్లో కరెక్ట్ చేశా కదా నేను. జస్ట్ నొక్కాలి. చేయి తీయకుండా నొక్కాలి. అట్లీస్ట్ 1/3 అయినా లోపలికి వెళ్ళేట్టు. ఓకే. ఓకే, రైట్. యూ షో దిస్. You want to try there or here, choking? Okay. You want. Very good. Yes. Okay? Okay. Heimlich you do. Next two come. You could do? Okay. ఎత్తుకోం కదమ్మా చెస్ట్ కంప్రెషన్స్ చెస్ట్ కంప్రెషన్స్ యూ వాంట్ టు డూ చోకింగ్ ఫస్ట్ ఓకే ఫైన్ no wait no you're not doing it right I'm coming support on your support yourself yes 5 okay నిప్పుల కింద కొంచెం ఓకే ఓకే రైట్ చెస్ట్ కంప్రెషన్స్ యూ ఫినిష్ చెస్ట్ కంప్రెషన్ CPR either 2 fingers or 2 thumb technique 2 thumb అయితే చెయ్యి you have 10 circle the body below the nipples below the nipple these are the nipples okay 1 2 3 4 okay okay clear okay you pressure everything your whole body is on the okay now ikkad nunchi ravali not here ikkad nunchi hand straight to ఈ పార్ట్తో నొక్కాలి సెంటర్లో పెట్టు టూ ఫాస్ట్ వందే భారత్ కొంచెం స్లో 1 and 2 ఏనానమ్మా కొంచెం అది చూడు నువ్వు పైకి రా ఇప్పుడు అను వెనక్కి వెళ్ళిపోతున్నావు నువ్వు ఇక్కడే ఉండు కొంచెం ప్యాషన్ యు సేవింగ్ ఏ లైఫ్ బలమంతా తెచ్చుకున్నావు ఎస్ కొంచెం స్లో అమ్మా ప్రెషర్ కరెక్ట్ పెడితే ఫాస్ట్ వెళ్తున్నావు లేకపోతే స్లో అయిపోవు రెండు స్లో చేస్తున్నావు డూ ఓకే ఓకే ఎక్స్చేంజ్ doing yeah okay so first lo jump ayinappudu hand aటు ఇటు jump avakudadu okay okay you sure he didn't do the chest compressions he didn't do actually let him finish Very good. Okay. Show me choking. That won't work. Only this will work. On that mannequin. It is designed for only Heimlichs. Actually, you are holding the neck. You have to hold the jaw, not the neck. Okay? And support on your knee. I mean thigh. Yeah. Now you do. Okay. Not on the tummy, just below the nipple. Okay. Okay. Come. Here one person can come. Come. Not there, little below. I put a blue pen mark there, just below that. Just below that, just below. Little more. I'll come. One second. 1 second. Lean it forward.
Right.
Did you put it inside?
Yeah, it's inside.
Okay. It has moved actually with your effort, little bit. Just show your hand, give me your hand. Yeah. Okay? Right? Now put this and back and up. 1 second, 1 second, 1 second. Now you do.
Oh,
That contact is should not
it should
go.
not move like this. Okay,
Yeah.
got it.
Got it, no?
Got it, got it.
Okay. Who you have done? Good. You have done choking? Okay, chest compressions you have done? Okay. Straight, straight. Oh. Okay. Okay. You have done choking? Come, someone come here.
Positions.
Yes. Okay. Below the nipple line. Okay. You next, whoever is there, come, two of you. You have finished everything, right? Yeah, that you go and practice there. Yeah. If you have any need help, call me. Okay. Wait, let me figure out. I don't know. I'm not able to help. Come. Show me chest compressions. Yeah. Chest compressions will do first. Yes. And choking. మెడ పట్టుకోకూడదు జా ఓకే జా నాట్ ద నెక్ ఎస్ కొంచెం పైన ఓకే ఓకే హర్షిని చూడలా ఐ డెంట్ సీ వెయిట్ హర్షిని do CPR. Your body should, the pressure should come from your body. Yeah. Yes. Okay? Chest compression. చూపించినా చూపించుమా ఇది బేబీని వదిలేస్తావా పెద్దవాళ్ళకైతే చేస్తావా మరి చూపించు సిపిఆర్ ఎలా చేస్తావు చెస్ట్ కంప్రెషన్స్ షో say 1 and 2 and okay now show choking jagrata anybody call me if you need meda nokkoduma yeah between the shoulder blades 1 2 3 4 5 yeah front chain ఇది బ్రెస్ట్ బోన్ కదా కొంచెం పైన ఇక్కడ బిలో ద నిప్పుల్ ఇక్కడ ఓకే ఎక్స్చేంజ్ బోత్ ఆఫ్ హర్షిని షెల్ వి డు వి హ్యావ్ దట్ ఆర్ లీవ్ ఇట్ అనిత బుక్ ఉందా Yeah, those of you, there is a medico. Her name is Anita. We are trying to raise funds for her treatment for leukemia. She needs something called CAR T cell therapy. If any of you is willing to donate towards the cause, just write your name and phone number. Dinesh, you will have? Yeah, with Mr. Dinesh there. You just will contact you. You can donate. If you're willing to donate for this cause, please write your name and phone number outside. It's totally voluntary. Okay? Yes. 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 Very good. Both of you. Choking issue. Managing a yes. Exchange. How many are there still with us? Only 5, huh? Okay. Yes. You should allow the recoil also. Okay? Little faster? Yes, yes. Got it? Okay. Now show choking. Yeah, you can go. You can go. Yeah, it would have moved. Sound has come means it has moved little bit. After that it won't work. It has moved only. Yeah. Yes. Below the nipple line. Below the nipple line. Yeah. Not on the bone. No? Just above. Yes. No, no, no. ఒకసారి ఇక్కడ రిస్ట్ మూమెంట్ హెల్ప్ అవుతుంది. ఎస్. ఓకే. ఓకే. You did chest compressions? You did both? Somebody come here. Go for the choking. Show chest compression. Nana, where is the tip of the breastbone? So where should your hand be? Yes, in the center. Straight. Okay, you should. Inka depth. Below the nipple line. See, these are the nipples. So just below the nipple line. Okay? Allow it to recoil. Okay. Okay? Bye. Okay. Choke. How many more are there? Only 2 of you? 3. Another one each from each group come here. If you have not finished. Exchange. Exchange. Allow the recoil also. Yes. Got it? You should. Straight. Straighten your elbows more. Straight. Make them straight. Yeah. Now you go. Some more straight. Yeah. You're bending your elbows. Yes. Now you do. Yes. Choking. here wrist movement is important. Yes. Okay. Both are done. Go to handlings. Consultants, if there is any pressure, like you are not able to make them finish, Vignata, side ke astumi chahiye, center. Oh, not so fast. 1, 2 and 3 and 4 and 5 and 6 and 7 and. Koncham faster. Yes. Okay. Yes. Nipple kinda. Yes. ఇందాక బాగా చేస్తున్నాం, కొంచెమైనా ప్రెషర్ వెళ్ళాలి. ఎస్. ఓకే. Exchange. You finished both? Huh? Yeah, just they'll exchange. Yeah, correct only. But, no, yes. Fast కాదు, ఒకటి రెండు. Wrist movement. కొంచెం. Yes. Okay. Both done. Come. One more person. You come. Show me chest compressions. Very good. Show. No, where is the tip? This is the tip. So here, your heel should be here, of the dominant hand. Straight. Again you're moving. Center. Straight. Now you're. Koncham. Yeah, now you're. Yeah. Yes. Okay. Exchange. No. Choking. Maybe little less pressure, baby, na? Okay. Next turn. No. Chest compressions. Hold the baby nicely. Support on your thigh. Yes. Leaning downwards, and with the wrist you press. Yes. Okay. Below the nipples.
Done.
Okay. Exchange. Chest compressions. Chest compression. No, one second. Where is the tip of the breastbone?
Here.
Show on yourself. 1 second, don't mind. Okay, here. Now, so your hand has to be here. Okay.
Below or
above? For CPR.
Yes.
Yeah. You're pressing too deep, because that will be too much.
Okay.
Yeah. Straighten your hands. Yeah. Now do again. Yes. Okay.
Yes.
Huh? Okay. Chest compressions. You should allow the recoil also. Okay? And now show choking. You are done, right? You are done?
Happy birthday.
Thank you.
Thank you for the session.
Thank you for the session.
Thank you. Below the nipple in the center. Okay? Next. Dr. Uday, Dr. Ishwar, if you have lot of backlogs, send some people here. Okay. Dr. Gayatri, Dr. Vignata, Dr. Nikita, Dr. Pradeep. Inchu. 1, 2, 3. Like you're pushing the thing, no? Yeah. Turn. Okay? Show chest compression. CPR. Ma. Below the neck. Some. Okay? Yeah. Show chest. Wait. You have to exchange. No? This is the tip, no ma. Don't touch the tip. That's all. Okay? Okay, exchange. That's for choking. Yeah. Don't hold the neck. Hold the jaw. Hold the jaw. Okay? Yeah. Yes. Not on the tip of the breastbone, below the nipples in the center. Yes. Okay? Okay. And the chest compressions did you do? Oh, yeah, do it. Yeah. Okay, you show chest compression. Okay, done. Next. Thank you. Come. Huh? Come. Harshini, you both have not practiced. Good. Very good. Show chest compression. కొంచెం 1/3 అయినా లోపల. You have to practice. Come. Yeah. Everybody. Yeah. Chest compression. For children, we have to use one hand. All of you remember, for children, we have to give chest compressions with one hand. Straight. Yes. Yeah. Okay. Come. So you are not done? Okay. Oh yeah. Sit. We'll do. Just compression. Yes. If you say hello, nobody will listen. You have to loud.
Hello.
Okay. And he's not conscious. Then you'll check for breathing. Look, listen and feel.
Not breathing. So I have to give CPR.
Yeah.
I have to give 30.
Yeah. Chest compressions and 2 breaths. If it's a child, you'll use only one hand. Okay. So where this is the tip of the breastbone. Feel on yourself. Yeah. Just above it. Yeah. Which is your dominant hand.
Right.
Yeah. Come straight. Yeah.
One.
Straight, please. Straight. Yeah. Little faster. Little more straight. Yes. Okay? Okay. If it is a child, one hand. Okay? No. We'll do. Just show chest compressions. Yeah. Yes. Show choking. Neck, jaw should be supported. Yeah. Very good. And yeah. Below the nipple line. Yeah. Press. Fine. Okay?
This is This one
For-
is choking or CPR?
This is choking.
Choking.
First
This is
what
CPR.
he showed is CPR.
That's
Okay.
not one hand, that's two fingers.
Yeah, 2 fingers.
Okay.
Or you
I
can
just
do
tried
this
it.
way also. Now you exchange.
Oh, sorry.
Yeah.
Yeah. So
Chest compressions for CPR.
the nipple is here.
Below the
Right
nipple.
below.
Yeah. Little faster. Not so fast. In between what you do. Yes. Okay? Yeah.
Or
Yes. Yes. Perfect. Yeah. And choking?
first between the shoulder blades.
Yeah. So, no, support. No. Use your thigh to support. Yes. Yeah. And hold the back. No. Support your forearm on your thigh. Yeah. Right. It's holding the jaw, not the neck. Where is your thumb? Yeah. And leaning downward. Yeah. Now? Yes. Okay? Yeah. Not come. And yes. Okay, leaning down. Yeah. So that it comes easily. No. That only I corrected myself in the end, saying you have to press.
Okay. Yeah. Fine.
Okay?
Thank you.
You come. You can do the choking there. And call me if you are not able to do. That's most important thing you need to know. No. Here it is just above this. Straight. Okay, ma'am. Yeah. Anybody else? Come. Ma, any backlog anywhere? Yeah. Okay, that's just compressions. Yes. You can sit and do also choking. Whichever is convenient, but baby should be leaning downwards, not upwards. And you have to support your arm. Yes. కొంచెం straight ఉంటే yeah. Any of you, if there is too much, come this side. There's so many vacant slots. Dr. Pradeep, Dr. Ishwar, Dr. Uday. If you have too many, done? Dr. Pradeep, you done? Okay. All of you did? Okay. Some of you can practice Heimlich on choking Charlie. Yeah. Yeah. Choking. Nikita, custom. It's so rough. My hand has got ruined only because sanitizer every day. No, skin is very. Yeah. Yes. Perfect. Exchange. Done, no? Okay. Everybody finished? You want to do? Done. Kuchu. You can stand. But you want to do only choking, right? Just give me your hand. My legs have gone numb. Yeah. Thank you. Yeah. Okay. You have to remove. After 3 cycles, if you are unsuccessful, you should start to the hospital or call 108. Don't forget that.
With your permission, photo.
Huh?
With your permission.
Yeah, sure. Anybody pending, ma?
Thank you. Many happy returns.
We'll all take a pic together before leaving, please. అందరిది తీసారా ప్రాక్టీస్ అప్పుడు లైవ్ క్లోజ్ అయిందా లైవ్ నడుస్తుంది ఓకే ఓకే
I just want photos. Thank you so much.
No,
Happy
no, no,
birthday.
no, no. He didn't make it loose because if it's loose, it won't anyway come out. Only if it's blocking, this pressure is going there and making it come out. So you've done good only. Yes, it has. It's come into the mouth.
You told me.
किसी पे गुस्सा है? Huh? It has come out anyway. पूरा दुनिया पे गुस्सा है. Thank you. I should thank Harshini for making it happen.
Excuse me, ma'am. Ma'am, can I have a picture?
Yeah, come. Lean in forward.
Give it to me.
It's come out only. Yeah.
Happy birthday, ma'am.
Thank you. They're doing live streaming, ma. Don't block.
Thank you, ma'am.
Everybody finished?
Happy birthday, ma'am.
Thank you. Is everybody done?
Yes, ma'am.
Can you help pack up ma little bit?
Yes.
You didn't complete the choking practice, I'm coming. Come from the other side, ma. That's live streaming. Okay, thank you. Come. Oh, I'll come. Okay? Yeah. No, it has not come out. Yeah. Now below the nipple line, chest thrust. Okay? Very good. Pack చేసేయండి. Okay. I think we can, yeah, we can close. So, most of those who attended today are medical students and some parents, and they will have a few more sessions, and once they are ready, they will start training teachers and staff from schools across Telangana. These are students who have come from across Telangana. So, wish them all the best. But live streaming can go on. Everybody done? Udit, done? Ishwar, done? All of you come, we take a group pic. And my birthday, so they want to. ప్రదీప్ ఎలాగ కెరియోకే వస్తున్నాను ఇప్పుడు రావట్లేదా? He was after me for the cake cutting and now he's disappeared. Will all of you pounce on it? Okay. Thank you so much. Huh? Yeah. Vegan. Okay. Since the past 1.5 months, I guess. Yeah.
So let's take this occasion to celebrate ma'am. It's wonderful.